mentioned, we're going to go through some quick introductions, and then we are going to on coordinated community supports call for proposals. We really want to make sure we get this in front of folks ahead of the October deadline to get those proposals in. We'll allow some time for an open question and answer session with our presenters, and then I will go over the BHAG partner survey that we are hoping some folks can complete before our next meeting. We'll go over community announcements, go over when we meet next, and we will adjourn by the 4:15 hour, if that sounds okay to folks.
Awesome, thank you.
All right, so we'll just open up the floor real quickly. Just if there are any new members on the phone today, if they would like to introduce themselves. And for folks who have been with us before, if you'd like to just put your information in the chat, we have to move through some things quickly today. So we're just going to open up this time for our new members.
Well, I am new. I'm Veronica Henderson Guerrero. This is my second week with Interdynamics as their proposal and grant writer, and I am so incredibly excited to be working on this very impactful project.
Wonderful, welcome. Anyone else who would like to come off of mute and introduce themselves? All right, we'll continue to use that chat function. And without further ado, I'm just going to open it up to our presenters today. So I'm going to stop sharing on my screen. And we can get started. Who would like to start us off this afternoon?
I think that would be Lorianne first. Is that correct?
I'm happy to go first.
Excellent.
Can y'all see my slides?
Yes.
Okay, great. We have given this slide presentation, we realized probably about 100 times. So please forgive me if I go through this somewhat quickly. I imagine many folks on this call have already seen it, but as we were planning ahead to talk about this meeting today, we thought we would go through the slides and just make sure we're level setting for everybody. So thank you so much for the invitation. My name is Lorianne Moss. I'm from the Maryland Community Health Resources Commission. My colleague Jen Clatterbuck is planning to join us. I know she's wrapping up another meeting. Jenna, are you here yet? Okay, Jen will join us soon. And a special shout out to Larry Epp, who's one of our subcommittee chairs. I know Larry's on the call. Larry, would you like to say a few words?
Oh yeah, I was just sort of coming to support Lorianne, but I just want to emphasize that this is such an incredible opportunity, and it just covers so many of the things that we've always wanted to be covered by a grant. And I think as Lorianne describes it, you'll see what an exciting.
Great. Thanks, Larry. Again, we will make these slides available to everyone. I won't read every word on the slides. What we thought we would do today is just give you a sort of an overview of the call for proposals that has been issued about a month ago, and support the planning efforts that are underway in Prince George's County. So glad to be joined by Carla and other folks we've been working with really closely in Prince George's County to make sure there's a robust process, and we get hopefully lots of applicants from Prince George's County. So just the background, the consortium and the funding that we're talking about was added to the Blueprint for Maryland's Future. That was that large education reform bill. It was sort of added in the final stages of the consideration because legislators wanted to do more to address student behavioral health as a way of also supporting their academics and whatnot. It is the consortium is part of the Maryland Community Health Resources Commission. I'm a staff on both. You'll see the CHRC come up a couple different times here. So the legislature named our chair, who is former Delegate David Rudolph from Cecil County. He's a lifelong educator and obviously a former delegate. Has been a great leader for our group. We also receive some technical assistance from the National Center for School Mental Health, and by some I mean a lot. They're really wonderful partners. I don't know if you all know Sharon Hoover and Nancy Lever, but they've been really wonderful for us to work with. Again, I won't read the name. Really diverse in every sense of the word from all across the state. A couple folks from Prince George's County, Dr. Donna Christie is a school psychologist. Gloria Brown Burnett is your director of social services. They both are very engaged in what we're doing. Again, you'll see a ton of expertise that's part of this. And these are our 4 subcommittees. We've got the Framework Design and RFP subcommittee that's really been working on the contours of what this first call proposals is all about. Our Data Collection Analysis and Program Evaluation subcommittee has been Larry Epp, who's on this call. Larry, we again thank you for your service. We've outreach and community engagement. We've done quite a lot of outreach, and that's been led by Tammy Fraley from the Allegheny County Board of Education. And then our 4th subcommittee is best practices, and they've really looked at what are the evidence-based programs that we know work for kids. And so they've put together a list of best practices, and we will talk about those soon. There's 4 overall goals for what we're trying to achieve with this funding and through the consortium. First is expanding access to high quality, that is intentional, high quality behavioral health and related services for students and their families. The second is improving that student well-being and readiness to learn. Third is fostering positive classroom environments. And 4th is looking at how we can leverage Medicaid, commercial insurance, and other. What this subcommittee has done is really put numbers or helped us develop measures, I should say, for each of these things. And so we'll be able to put numbers behind the consortium's outcomes in terms of expanding access and improving student well-being. And so those are our goals. And so we're looking for projects that do, certainly in this RFP, we're looking to do number 1 and number 2. To some extent, number 4, if you're able to leverage those other funding sources. And then positive classroom environments is something that we're continuing to work on. Okay, so this is just our organizational chart to help orient around the alphabet soup of agencies that are involved here. First is the consortium. That's the 25-member group. They're sort of the architects of what we're trying to accomplish here, developing that overall policy framework. The CHRC is the fiscal agent. So it's actually the CHRC that has issued the RFP and will enter into the legal bits. The National Center, I've discussed, they provide assistance to everyone, consortium, CHRC, as well as our future grantees. And then down on the bottom left, you'll see the future partnerships. So that's what we're trying to grow across the state, a network of partnerships. Then right in the middle, you'll see that role of the local education agencies. They will not receive the grant funds directly, and they will not be making grants, but they really are integral to this process. So one way to ensure their appropriate role is through letters of support, which we will talk about, and really just this ongoing collaboration with the consortium and with any grantees that are in their school district. So here are the quick facts about this first call for proposals that went out in August. This will be for services only. Up to 120 million will be available all across the state. We often get the question, how much should I apply for? What's the range of funding? And the answer is we don't have a range of funding. We think there are going to be some big requests and some small requests, and there's just going to be a lot of variety. We realize in the future we'll probably need to think about a statewide formula, but for this RFP that does not exist. If a proposal we can't fund, we will go back to the applicant rather than throwing out the whole proposal. We may go back to the applicant and request some trimming to the budget, and that would be done in concert with the school district. As I've said, each proposal that we receive will need a letter of support from the local superintendent or the superintendent's designee. And it would be each applicant should submit one application per jurisdiction. If you're in multiple counties, that's great. You can apply for each county, but you'll need to apply separately. Y'all still hear me? Everybody still with me?
Yes. Still here.
Okay, great. On Teams, I can't see your faces, so I'm going on faith here. All right, great. So this first call for proposals will support services at all 3 tiers of that multi-tiered system of supports. So you've got your prevention efforts for all the students. You've got your brief or small group interventions for students that are more at risk. And then, of course, your one-on-one, more intensive services for the students who need those the most. So all 3 tiers are all things that we would support through this funding. What we're looking at is 18-month grants. So if you think about the school calendar and the timing of when this RFP is going out, we would support projects probably that would start in the spring semester of this current school year, and then projects for and then they would continue through the next school year. So that's how we come up with 18 months. And then in the future, I think we'll be more aligned to the school calendar, but we're just getting started here. So the third bullet, programs could be brand new programs, new to the schools, or it can be expansion of existing programs that are already in the schools. The fourth bullet, it's really important that the funding not supplant existing funding that's already coming in. We don't want people to, like a shell game of moving around dollars. It really needs to be a true expansion of behavioral health and really new dollars. And then the final bullet, we get this question a lot. We know space is kind of a premium in the school buildings. And so the service does need to be connected to the school, but that doesn't mean it needs to be in the school building itself. In fact, applicants can apply for transportation dollars to get kids to the services, to get the kids home from services, whatnot. We want that connection to the school, but again, it doesn't need to be in the school building itself. So here are our key dates. I said the RFP was released. We had a FAQ call that had, almost 500 participants on it. So we've got that call is recorded. We did a written summary. We've got 17 pages of questions and answers. Lots of resources on our website to help folks apply. Those applications will be due October 11th at noon. Please do not click send at 11:59. Give it a little time to travel through cyberspace there. Please, it comes up every time. So please give yourself a little time for that application to come through. Award decisions will be made in December. And then, as I said, we're looking at an 18-month grant period. Okay, so these are the types of services that we are interested in funding through this call for proposals. And you'll see it's really a lot of things. The traditional therapy we might think about, wraparound, substance use. We've heard as we've done this outreach, a real need for more substance use programming in the schools. Again, looking at families, oftentimes you can't really meet the child's needs without meeting the family's needs. And again, that last bullet, preventative programming, definitely is something that we're interested in supporting. At the bottom, you'll see this reminder. If a service provider is doing a service that is billable to Medicaid, we would like them to bill Medicaid, and then they can use the grant dollars to fill in any gaps. Now, a lot of services are not Medicaid reimbursable, and so grant dollars would be used for that. And a lot of kids don't have Medicaid, right? So again, we're just talking about if a service could be billed to Medicaid, if the child is enrolled in Medicaid, to please use Medicaid and then use grant dollars to fill in the gaps. So as I said, the best practices subcommittee has been looking at what are some effective evidence-based practices for student behavioral health services. And with a lot of support from the National Center for School Mental Health, support from our colleagues at MSDE, and public comment, they came up with a list of 15, we're calling them priority evidence-based practices. And these are proposals, are programs that we really want to try to push out statewide. We really want to encourage folks to take a look at these programs. Grantees that want to use one of these programs would receive training and implementation support through the National Center, our partner. They would get a little bit of added consideration during the application review process, though I would say that's 5 points out of 100. So it would be just one of many things that would be considered when the applications are reviewed. You also see on there a learning collaborative on measurement-based care is sort of in the same vein that an applicant could select. So that is our list of priority evidence-based practices, but we know there isn't a one size fits all. So we are also permitting applicants to show us other evidence-based programs and practice-based strategies that they would like to utilize if nothing on that list of 15 really makes sense for their community and what they're trying to do. So there would be a little bit more justification that they would need to provide for those kind of strategies. They would not receive that implementation support from the National Center, and they would not receive those extra 5 points. But we are very open to these other kinds of approaches. I'm getting close to the end here. So let me just scroll up. So if you go to page 9 and 10 of the RFP, you'll be able to see the lists of all these programs. Okay, so we're getting close to the end of the presentation. And I just want to say a few words about the role of schools, and then I'm hopeful our partners in Prince George's County can talk about this a little bit more. We have been really looking for school districts to figure out what their priorities are, where the gaps exist, and sort of share this with providers so that we know providers are applying for the right things, right? So that they're meeting the actual needs that are in the community. As I said, all applicants will need that letter of support from the school district. And the letter of support is not just, this is a great organization, but we really want this program in our schools. That's what the letter of support is about. We don't want to be funding a program that the schools don't want. We will ask the school districts to attest that the funding is not going to supplant existing funding that they're getting for student behavioral health. And we really feel it's best practice for school districts to have an MOU with their providers before those services are initiated. And I will just jump to the final bullet. We are offering training to the school staff in those evidence-based programs and even a couple others. That's going to be a process different from the RFP, so they can follow that link. So I believe, oh, this is an important slide, right? How to apply. Okay, so there's really 3 steps. First, we've got an electronic cover sheet, which is that basic information about the grant. And then we need the full proposal submitted electronically to Jen Clatterbuck. And then we're looking for 2 copies to be in the mail, postmarked October 11th, also mailed to our offices. So all 3 of those things. We've received a few cover sheets already, and so we're hopeful that they will finish the application process by doing steps 2 and 3. Great, and so here's just some contact information for us. Our website, we've got a mailing list to help keep folks informed. So I will take down these slides, and like I said, we can make these available for you all. And I'll turn it back over to our MCs, and maybe we'll hear from some of the other folks in the county.
Yes, thank you so much, Lorianne, for that. I have seen that presentation 3 times, and every time I leave knowing something that I didn't. So wonderful, wonderful as always. And I see Jen was able to join us. Jen, do you have anything you'd like to add?
Just again, my apologies. We're actually in the process of putting together a separate RFP covering health disparities in our state, and so I very much apologize. No, again, Lorianne knocks it out of the park every single time. And if you have any questions, I am here as well.
Thank you. Thank you both so very much. And folks, just a reminder, if you'd like to put your questions in the chat, we'll have a few minutes after our next presentation for folks to be able to answer some questions. Carla, would you like to go next?
Absolutely. Lorianne, thank you once again for your time, spending it a lot of time with Prince George's County applicants, potential applicants. So really appreciate the partnership there and the support. Hi, everyone. My name is Carla Plaza. I serve as a strategic advisor to the DCAO for Health, Human Services, and Education in the Office of the County Executive. Before I begin, I want to double check if there's anybody from the school system team that's on the phone or on this call. And if you wouldn't mind raising your hand, if you want to chime in at any point, please do. I want to preface my quick presentation by saying that I am not part of the school system team, but I'm here in support of all this great work and all the enthusiasm that we're trying to garner in the county so that we can get as many applicants in to this great opportunity. We just see a tremendous potential to really make a difference for the students. And so we're just here to support our applicants. So as I mentioned, I am not part of the school system team. So I'm just going to go over some slides that they presented a couple weeks ago, but also I'm going to provide you all with the link so that you can actually hear from the school systems itself. And Lorianne was on that call. In case you have if you want to hear from them what their priorities are, some of the FAQs that were answered, their process, you will have access to a Google Drive that contains that information in a folder that's marked September 12th, I think. But I have it all ready to go in a chat. So as soon as I'm done talking with you all, I'll put that link in the chat so you have access to it. So a couple of things I want to share and lift up to your attention. So this is the presentation that the school system gave, and my apologies if I'm not looking directly at you because I'm using my other screen for this. I'm not going to go through all this because this is obviously not something that I created, but do want to offer some highlights of this presentation to you all. So a lot of the questions that we received were in terms of how do we know which schools to work with, which populations are priority, is there anything that applicants need to know, and in reality, I mean, the message from the school system that is loud and clear is that everything's a priority, right? There's such a need for services among our students that they're happy to consider all applicants as they think through their letters of recommendation in terms of the services that are provided, work within all the different schools from pre-K to high school and across all, a wide range of populations. So this slide really mirrors the slide that Lorianne shared in terms of, some of their priorities that they're looking to support within the school system. And then the most important, I think, piece also is what is the process for getting these letter of recommendations? And the letter of recommendation really is, it's a link that I'll put also in the chat. I know, I think Kim put that in the chat already, but it's a link to this form. And in order for you to get that letter of recommendation, you have to fill out the form. They're not necessarily going to meet with people one-on-one to discuss their application because of capacity issues. They're just stretched too thin. But this is the first step for you to inform the school system that you are applying, and you are required to fill out this form so that they can consider whether or not to offer a lot of support. So The other thing I want to underscore is that they're reviewing letters or these requests every Tuesday and Thursday, and they're going to try to turn this around as quickly as they can. And if for some reason things are stuck or if you need additional support, you can always contact me, and I'll put my email in the chat so we can see where we can help nudge things along or offer additional help to the school system. But like I said, you know, their process for getting this required letter of recommendation is to fill out that Google form, and then just know that that inbox and that those forms are being reviewed twice a week. And at this point, they are not taking the one-on-one meetings with individual applicants because of capacity issues. So once again, this whole presentation will be available in that Google Drive for you guys to look at. But here's some of their, you know, as they evaluate the letters of support, what they're going to be looking for. And then the other important piece of their presentation was this email address. And like I said, all this will be available to you on that Google Drive. Let me stop sharing. And then the other thing I wanted to quickly do in terms of a review of some of the questions that we've been receiving from the community in terms of just general questions as it relates to their applicants. A lot of it, are there priority schools on which to focus? Not necessarily. They're all a priority because not every school has all the needed services. And so just keep that in mind as you think through, you know, where you would like to be and what you can offer to the school system. Does a provider need to be physically located in Prince George's County? No. So if you all know of great programs that are not yet in Prince George's County, but you think it would make a huge difference, we say help spread the word, right? The more applicants that we get to help support our school system, the better, or students, the better. Is there a particular area of need that has been identified by the school system? Yes and no, right? That presentation that I referred to offers some additional information, but what I recall hearing was there was a need for behavioral supports, particularly in the younger years, right? So our pre-K, K, and first grade students, and then a need for supports around substance abuse. They saw a huge increase in fentanyl use last year. And so that came up as some areas that, you know, they're trying to address. But once again, I encourage you all to listen to their presentation and hear what they have to say in terms of their supports. Is there a higher priority for certain schools in the county? Not necessarily, but I'll refer to that presentation because they answered that. Is there a preference for elementary, middle, or high school? No. Going quickly over some additional FAQs. I think I covered the bulk of what was shared during that call. And I'm going to go ahead and pop the link to that Google folder in the chat, as well as my email address. But I also, for those of you that are involved with the local behavioral health authority, they've been the ones that have been communicating all this information out to those who sign up for the distribution list. And I'll see if I can quickly find that email address and also pop that into the chat if you're not on that list. And all you have to do is just say, please put me on the Coordinated Community Supports distribution list in order for you to receive any additional information that comes out. So I'm happy to answer any questions to the best of my ability. But once again, underscoring that I'm not PGCPS staff. I'm just here in support of this great initiative.
Thank you so much for that, Carla. And we have a hand raised.
Yes. Hi, this is Evelyn Lobos from Shepherd Pratt. Our email account is through Outlook. So when we access the Google Doc, we can't access it with our Shepherd Pratt email. Can we use a personal account like Gmail, or would you prefer us to, how would you prefer us to access that document?
The Google Drive?
Yes.
however, however you want. It doesn't matter.
Okay.
It's
Because
just it's a public folder.
okay, well, it won't let us use any other email. When we were trying earlier, it had to be a Gmail account. So I just wanted to make sure.
I've set it up so that anybody can access it, but I'll double check the settings again.
Perfect. Thank you so much.
And it may be on the request form for the letter of support. I had this issue the other day when I tried to log in with my county email. I was able to access the Google Drive okay, but it was the actual Google form to request the letter
Yes,
of request. Okay.
Yes,
So it's
that's
this,
what I was trying
I'll
to say.
double check with the school system to make sure that their settings are open. Okay, thank you for that.
And any other questions for Carla, Lorianne, or Jen?
And then I saw this chat from Jordan. Jordan, I would please ask you to just email the email address that Taylor put on and that way nothing will get lost between now and then. So please email the LBHA to get on that distribution list. And I'm here to support this initiative. So if there's any questions around process, or if there's something that you think might be stuck, please don't hesitate to reach out to me. That's what I'm here to do, is to make sure that that those that are interested in applying are able to apply successfully.
Thank you for that, Carla. I just realized I said that and I was still on mute. Apologies.
You're very welcome.
We also have a mailing list. It wouldn't be obviously Prince George's County specific, but I'll put that in the chat as well.
Awesome.
Thanks, Lorianne. Did you want to put the link to the call for proposals page as well? Assuming people have already seen
great.
it.
I'll put both of those in there. Never hurts, right?
Yep, we posted an updated FAQ document this morning. So.
And we will be sure to send out slides to everyone with the meeting notes and all of these links. But any other questions for our presenters?
Nope. I want to thank everybody. This has been really helpful to me, and I've seen that presentation before as well, and I keep learning stuff. So thank you all.
Good.
There's a lot of information.
A lot of information.
All right. Well, thank you so much for your time today. We really appreciate you guys giving this presentation. It has been very helpful. We will be sure to share out all information, but folks on the call, just keep that marked on your calendar for October 11th at noon. Be sure to get in your request for a letter of supports as early as possible. We want to make sure that we are not overwhelming the school system, and be sure to direct any questions you may have to any of those emails that you have received today.
Thank you. Thank you, Taylor.
Great. Taylor, thank you so much for having us.
Absolutely. Thank you so much, Lorianne, Carla, and Jen. Thank you so much for your time today.
Thanks,
You're welcome.
everyone.
Bye, everyone.
Have a wonderful rest of your afternoon.
Thank you.
All righty. Any reactions to those presentations? I guess a lot of people have seen those presentations a few times. All right, well, we just wanted to make sure again that we were getting that information out. So we will move forward with the next thing on our agenda. So let me get this loaded here. And are folks able to see my screen?
Yes.
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 Yeah.
Okay, thank you so much. Sorry, I cannot see faces on here, but so next we wanted to start promoting the partner survey that we were going to ask members on the call to complete. So if you scan this QR code, or we will send out the link and we can put that link in the chat. We're just asking folks to fill out a short survey, asking about your organizational affiliation, the services your organization provides, the populations of focus that your organization provides services to, and we are looking to reschedule future BHAG meetings. We know that there was a schedule conflict today that will be happening quarterly, so we want to make sure that this meeting is not a barrier for anyone who would want to participate in the future. So we have some new meeting times suggested. If anyone would like to suggest another meeting time, please feel free to add that to the survey. We want to make sure we can get as many partners to the table as possible for these monthly meetings. And we are asking that everyone complete the survey by Wednesday, October 4th. That will give us enough time to put the rescheduled meeting on everyone's calendar to make sure that you have enough time to arrange for things to move around on your calendar with this new date. Does that sound okay to folks?
Yes.
Yes.
And I'll just add, with this, we have we've pre-selected some categories on this survey, but certainly we did not cover everything. We did not cover every population of focus or services provided. So please make sure that if your organization is providing other services or servicing other individuals, please make sure that you're putting that on the survey. We want to make sure that we are inclusive to your organization as much as possible. And especially we want to be sure that we're able to identify who is missing from these meetings in the future. So the more we know about you guys, the more helpful that will be for us moving forward. All right. And not to put our co-chairs on the spot, but did you guys have any updates you wanted to provide to either the consortium presentation or to this survey before we jump into community announcements?
No, Taylor, I think you've done a wonderful job and we appreciate you coordinating everything for us.
Absolutely. Thank you guys for being on. All right. So we will go ahead and jump into some community announcements. So a lot is going on. It's going to be a busy October. So we just wanted to put this on everyone's calendar. The Department of Parks and Recreation is putting on a few events during the first week of October. So they'll have some pretty awesome activities going on for Mental Health Awareness Week. A lot of activities to reduce stress and just get out and get some fresh air. So here is the link, and we'll be sure to put this in the chat where you can go to visit and check out some of these activities and share with your networks. The Maryland Department of Health is also putting together a summit, the Together We Care Summit, that will be hosted next Thursday, September 28th. And that will be an all-day event, and you can register for the event using this link below. And I'll be sure to put that in the chat, and it'll go out in the meeting notes as well. The Maryland Department of Health is also hosting the 35th Annual Suicide Prevention Conference. This will be a virtual opportunity that you can register using this link. There is a conference fee of $45 per attendee and $10 for students. So be sure to share this with any of your networks and anyone who would be involved. This is an all-day conference for partners to be able to come together. And again, this is a virtual conference. All right, and the University of Maryland, the Horowitz Center for Health Literacy, also on October 4th, is hosting an in-person event for the Consumer Health Information Hub, and we will post this registration link, and this again will be hosted in person at the University of Maryland for partners to come together to learn more about health literacy and what the hub is currently working on and advancing to be able to promote plain language skills and unite partners to promote health literacy. And lastly, some more information coming from the Maryland Department of Health. There is a new toolkit, the 2023 Suicide Prevention Month Toolkit, Connecting to Hope, that is tied with that summit that is happening in early October. I'm sorry, in the end of September. And so if folks would like to check out this toolkit, we also have the link here for individuals to share through the rest of the month and into October. And with that, I shared a lot of information. So does anyone have any other community announcements that they would like to share while we are all together?
Good afternoon, Taylor. This is Denise Dunbar, Public Health Program Chief with Behavioral Health Services Division. Just want to share some great news that the Behavioral Health Services Division were the successful awardee of 3 grants between the spring and the summer. We were awarded the Adult Reentry Program grant for $400,000 from SAMHSA. And then next, we were awarded a System of Care grant again for $1 million over 4 years from SAMHSA, and a Healthy Transitions grant targeting young people 16 to 25-year-olds. And that's also a SAMHSA grant, and that's for $750,000 a year for 5 years. More to come because we'll be setting up similar kind of processes for both the healthy transition and continuing the SOC process. So more to come.
Congratulations, Denise. That's wonderful.
We are very, very excited. Thank you, Margaret. Lots of funding to advance and improve access to behavioral health services for children, youth, and transition age youth and their families in Prince George's County. So we're really, really excited about this new funding.
Congratulations. And anything you would like us to share, Denise, we would be happy to put in the newsletter moving forward. So as soon as you have more information, do keep us updated.
I'll send you some information that we have right now on the grants.
Perfect. Thank you so much.
Mhm.
Right. And any other community updates? All right, well, I will just share this last slide then. We will be meeting again next month. Our next meeting is on Wednesday, October 18th. That date or that time is to be determined based off of the results of the survey that we are hoping everyone will fill out. So we will be sure to let everyone know by that deadline of in October of our next meeting time, but we will be meeting on Wednesday, October 18th for now. So with that being said, thank you so much, everyone, for getting through all of our presentations today. Thank you to everyone who has heard this information before and is still learning some more about everything with the consortium and that call for proposals. We will be sure to share out all of this information after the meeting with the meeting notes. But other than that, please do let us know if there's any way we can support you before our next meeting together.
Thank you, Taylor.
Thanks, Taylor.
Thank you.
Thank you.
Everybody.
so
Thank you very
much.
much.